Hey, and welcome to Your Health Truth. I'm your host, Brock Hardman. And from time to time, I'm going to come at you with my opinions on how I feel our healthcare industry is doing, not necessarily supplementation or diet, but my opinions on why I actually even created my site in the first place. And today is one of those days, so you are in luck. Now, today we're going to talk about why our healthcare insurance system is absolutely broken. There's a lot of reasons why it's broken. First and foremost, if you think about it, it's set up as a business. Yes, we do like to make people better. However, we do like to get paid too. So, if you weren't aware of this, our healthcare system is 16% of the GDP in America. To me, that is absolutely ridiculous that we're treating healthcare as a business and not as a system to actually make people better. Because if you think about it, if we were really truly focused on making people healthier and less sick, then our healthcare system, the cost would be doing this. Instead, it's doing this. That's simple, right? Simple analogy, it makes sense. So, why do we continue to do this? Well, because our system is broken. It's all about profits. Now, sure, we like to try to help people and get them on medications, but there's no money made in prevention. There is money made in prevention, but there's a lot of money made in treatments, and that's what we do. And we started on this path a long time ago, and it started working, and there was a lot of money to be made, and we've continued that trend ever since. So we need to start heading down the path of making people aware of how to live healthier lives so that our healthcare costs go down. And it's not a business, it's more of a system to help people. Help people live healthier lives, and you don't need to go to the doctor. And so, if you think about car insurance, for instance, if you go and you get in a wreck and you pay for it, okay, your insurance is going to pay for it, and then your premium the following year is probably going to go up. Same with home insurance. If you have a claim on your home insurance, your policy is probably going to go up because it's based on your individual claims. And then if you go out and you get in 5 or 6 wrecks in a given year, you're probably going to get rejected. So why don't we do the exact same thing with healthcare? I think it would be a perfect solution, even though I think in general insurance companies don't need to exist. I think that there's better ways to, help people out if they need help. And I don't think insurance in any regard is the answer, because there's profits being made in insurance. Even the health insurance companies make billions of dollars in profit. So, that should tell you right there that there's something wrong with our healthcare if people are making a profit off you getting sick. So anyway, back to the car insurance. Now, if we all went out and we all played bumper cars every day, that would be ridiculous because we know that we would get dropped from our insurance. However, a lot of us go out and play bumper cars with our health every day because we know that someone else is going to pay for it. So to me, that's the fundamental flaw in our system, is that we have the laziness mindset that someone else is going to pay for it. All I have to pay is a $20 copay. I don't care about the other $200 and whatever dollars it costs for the doctor, because that's paid from everyone else, including myself, but we're all lumped in together. I believe that if we put people on a plan to where, if you act recklessly, as in car insurance, and you have a lot of claims, that you should pay more. Now, there are certain circumstances, I'm aware that some people don't ask for what they get. They're handed a disease that's pre-existing, or that, they live healthy lives and something freak happens. I understand that happens. And so that's a rare occurrence. For the most part, over 80% of disease is preventable. So I think that, if we had a system that held people accountable and responsible for their own actions, we would get a lot more done. If someone had to pay more, if they got sick more, I think that they would think twice about, living off cheeseburgers and cheesecake and Twinkies. And, I'm at the supermarket and I see, a 400-pound person with a cart full of Twinkies and Ding Dongs and Cheetos and Ho-Hos, and I'm like, man, I'm about to flip out because I'm having to pay for their poor decisions. Give me a break. So, the purpose of my site is to educate people. But an even bigger, deeper underlying theme is that I do not want sickcare, aka Obamacare, to actually be enforced. And I know it's been passed, but there's ways around it to keep it from actually getting truly enforced. And if we can avoid that, then we're going to save our generation and our children's generation a lot of misery and a lot of debt. I'll get into that here in a second. But if you think about it, we have a broken system that what Obama is trying to do is make a broken system a more available broken system. Does that make sense? If you have a broken system and you want to give it to more people, you're not helping anybody, you're just making it more available. And so we're not solving anything with his proposal. Now I'm in the process of creating my own kind of healthcare bill that is going to be less than 1,000 pages, I promise you. But, what we're doing is, keeping people sicker longer. That's what most of our healthcare system does is, someone will come down with high cholesterol, let's say, or high blood pressure, or diabetes, or whatever, and we put them on 7 different medications. And sure, they may live longer, but they live sicker, and that's all they're doing is living sicker longer. You're not fixing the underlying condition, and that's what we need to start doing is treating the causes, teaching prevention, and understanding that there's underlying causes that can be treated without most medications. Now, there are some medications that are necessary. I won't get into all that right now, but just know that, a lot of medications that people are on aren't really helping them cure what's going wrong with them. So, just the whole way it's structured is it's all about reimbursement and getting paid. Because doctors don't care, insurance companies don't care. It's just a big revolving door about, it's broken, who cares? I'm getting paid because I'm getting reimbursed by the insurance companies. Insurance companies get reimbursed by you. And so, go do some research on what it's going to cost America if Obamacare actually gets enforced in 2014. And I think maybe you'll start agreeing with me that we have to do something about it before it happens. I think Texas alone, it's something like $60 billion, as if we have that money. I mean, we're already bankrupt. Social Security is already down the toilet. And now Obama wants to, make us bankrupt even more. I don't get it. I mean, he might as well, buy us all plasma TVs. It's the same difference, spending money that we don't have on stuff that we don't need. And so, that's it. Just wanting to kind of enlighten you on my opinion on why I created my whole site in the first place is to teach people that our healthcare system is broken. We need to change our mindset on how we approach health, and we can reverse the trend of our downhill spiral in our healthcare costs. And I'll talk more about that on future posts. But that's all I got for today. So thank you. Talk to you tomorrow.